South Australian health services have vowed to wage all-out war against the federal government. The health minister this afternoon held emergency talks to discuss what he says is an all-out crisis.
An emergency meeting like we've never seen.
Thank you very much for coming at very short notice.
More than 20 representatives from our state's health system in one room, worried about $600 million in cuts over the next 4 years.
That equates to just under 600 hospital beds.
They thrashed it out behind closed doors for nearly an hour and emerged for a media conference, stepping up one by one to voice their concerns.
We are absolutely disgusted with the cuts that are being handed down.
This is bad, bad, bad for health.
It'll lose quality and quantity and access that the public deserve.
This is a direct attack on health consumers and the health and wellbeing of South Australians.
Mr Snelling says that, coupled with co-payments for doctors' visits, will overload emergency departments.
And I would expect an almost immediate effect.
But as for raising the GST or introducing an emergency department tax...
Yes, I'm happy to completely rule it out.
But while they're determined to fight together, the challenge now for all of these representatives is to work out how they can keep providing high-level services with much less. The opposition says it's against the federal cuts too, but claims the state government is also to blame.
I think part of the game that Mr Snelling and Mr Weatherall are playing is they're trying to hide their significant cuts to the health budget.
Protecting the nature of our hospitals is not a game.
Either way, hospital patients fear they are the big losers.
I think this budget's probably the worst one I've ever come across in all the time I've been voting.
We'll be on waiting and won't be able to necessarily get into the hospitals as quick.
We are in debt, aren't we? So something's got to give.
Eddie Godfrey, 9 News.